Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Practitioner.
It's a new thing. They've changed my credentials. I'm no longer a nutritional therapy counselor. I am now a nutritional therapy practitioner.
That's awesome.
It is. It's very fun and interesting, and yeah, I'm excited to go to the nutritional therapy conference at the end of the month and, connect with all my peeps. I'm actually hosting a roundtable at the nutritional therapy conference.
Is it open to the public? Can people come?
It is not. It's,
okay.
Kind of an elite group.
Yeah.
But I'm actually hosting a roundtable where there's going to be 3 sets of tables, essentially, that I'll be answering questions at, where they ask questions about what it's like to be a nutritional therapist working with a physician. So I'm excited.
Pretty good.
Yeah.
All right.
Totally off topic, though. So
what are we talking about today?
Today, we're talking about body lifts. If you're interested, there are some slides that are interesting that go along with this podcast. If you'd like to see those slides, you can go to our YouTube page with it, which is at Jason Martin MD. Also on Instagram, we are at Beauty and the Surgeon podcast. So not a ton of slides today, but there's some interesting ones, some good pictures.
It's taken us 71 episodes to talk about body lift, and I don't understand that. I mean, body lift is one of the bigger surgeries we do in plastic surgery.
I mean, I would argue that it may be one of the standalone biggest. I mean, as far as like length of incision and kind of transformation in one surgery alone.
Right.
It also is not something that we do very commonly because mostly our population base, but also because it is such a big surgery.
Yeah.
Yeah. So we can start with the statistics. We still, even though it's 2020, we're still looking at the statistics from 2018. The 2019s are not published yet.
I think they get published in the springtime.
Yeah. So that probably makes sense at the convention.
At the spring conference, yeah. So
which
we'll
is
see.
in a few weeks. So right now we are still looking at 2018, but interestingly enough, there wasn't much change between 18 and 17, only about 12 people. So in 2017, there were 9,075 body lifts performed, and in 2018, there were 9,098. So a very small difference. Amount of change was actually 0%, so it's such a small change. But the change from 2018 back to 2000 was 4,295%.
Which is crazy.
Up from 207.
So many things associated with that. One of the bigger things is bariatric surgery or weight loss surgery, and you should listen. We always mention the same one, or I do at least. The episode we have with Matt Metz, there's no video to that. He's a weight loss surgeon. It's much more common these days.
Yeah, it is.
So massive weight loss, and that's the medical terminology, is more common these days because of these surgeries, and those are the people that commonly come in for a body lift. So you could see body lift, the use of it, go up with the use of these surgeries. They're positively correlated with each other.
Yep, absolutely.
It's still not a lot. We've done episodes on every different surgery that we do, at least on the cosmetic side, and this is only around 10,000 or 9,000. And if per memory, breast augmentation was over 200,000, right? Mm-hmm. Maybe even close to 300. Yeah. So it's a small portion of what we do. It is one of the most transformative surgeries that we do. It also has the longest recovery and the highest complication rate of any surgeries that we do in cosmetic surgery.
Yeah, and you and I were talking a lot about that yesterday because, again, going back to the fact that a lot of these surgeries are performed on people who may have had bypass surgery. Bypass is a malabsorptive surgery, meaning it takes away a very significant portion of your stomach, but also of your small intestine. So
some of the bypass surgeries do. Yeah. Bypass, the literal bypass. Sometimes it gets really confusing with weight loss surgery. Some people get the gastric sleeves, which is like, narrowing the stomach. Some people got gastric bands, but the true gastric bypass is a malabsorptive surgery in itself. Yeah.
And anymore, I mean, even when we talk to Dr. Metz, it's very uncommon to do the
sleeve alone.
Yeah, the sleeve or the constrictor thing because of the issues that they had with them.
Right. People would eat through them, or they would fail.
Yeah, or they would cause issues with the pouch that was remaining because of erosion. So there were issues with that. Most commonly, and that's the type of surgery that Dr. Metz does, is this malabsorptive surgery. They've found great benefits of doing it as far as, long-term outcomes of other comorbidities. However, it does make it so that you cannot eat a normal, quote unquote, normal diet for the rest of your life because you have to be very careful to make sure you're not getting malnourished, becoming malnourished because of your limited ability to eat quantities of food. So,
and those patients get supplemented with certain vitamins I think it was the fat soluble ones.
Yeah.
Right.
Yeah.
So,
And so then you take this population base who has been very overweight, so maybe has some other comorbidities to begin with. Their body has also at some point in time been under a large amount of stress. They've had a BMI that's over 35 for at least an extended amount of time. Your body doesn't just completely bounce back from all of that. So it makes sense then to go into another big surgery that there may be some limitations there to their health.
And one of the risk factors for complications, and I looked this up, this is from one of our professional journals, is the maximum BMI of the patient historically.
Right.
So
what their max BMI was
right.
prior to
So
surgery.
if you're considering a body lift and you've had massive weight loss, just know the higher your weight was at its peak does increase your complications with a body lift, even if it's like 3 or 5, 7 years down the line.
Right. Even if you're at your goal weight.
So clearly the body's physiology changes at severe obesity, and even with weight loss, and especially with the type of weight loss surgery that Amy's referring to, which is the most effective, which is the malabsorptive gastric bypass types, and there's different ways to do that. I think Metz did a duodenal switch, gets really in the weeds with that, but that was interesting. And then he said that it really helped them control diabetes, at least in the European study, which I thought was
even
really
on normal weight patients, which was very interesting. Yeah.
So with that said, you have to consider that even if you are a pretty good weight now and you're going to do this body lift, if you had massive weight loss and your BMI was very high, that puts you at higher complications after a body lift. I thought that was really interesting.
Yeah, it makes sense, but
it's not just the BMI at the time of surgery; it's your maximum BMI.
Yeah, what the height was. So with all that said, what is a body lift?
That sounds like a philosophical question.
Right. Well, I didn't say what is body uplifting.
Yeah, let's just break it down. Let's say a body and you lift it, right? So basically, though, it's a body lift, but it's not really a full body lift. It's a lower body lift. I mean, that's what it does. So it really should be lower body lift. There's different approaches to it. You can do the front or you can do the back, but most of the time we do it circumferentially. It's called a circumferential body lift. And then a lot of times with it, we'll do a tummy tuck or something we call like a belt wipeectomy, which is to take the fat out all the way around your waist. Whatever the case is, you're lifting the lower body in the butt in most cases. And that is what we call a true body lift.
Yeah, and we have a great, the picture that we have up now. So if you're watching us on YouTube, you can see that there's a picture kind of the dotted lines.
And you can tell Amy picked out the pictures because they're actually pretty good. Right. When I pick out the pictures, she's always like critical.
They're kind of random. I mean, well, this one, it does the same woman. I feel like we get her a lot, the woman that has to pee.
Yeah,
so
has
she's
to cross
still
the
here.
legs.
Yeah, she's still here.
She's on a long car trip.
She doesn't have to after
And you
surgery.
know why they do that. If you look at our YouTube, please, at Jason Martin MD, if you look at the YouTube channel, they're crossing it because they don't want to show the lady parts, right? That's basically why.
Yes.
But just ghost them out.
Right? Like a Barbie doll.
You don't have to be anatomically correct.
Right? She doesn't need full labia.
Right.
Yeah, no. So,
why do we have to do the cross the leg?
She's shy.
Okay.
Yeah, she's shy. So it kind of shows, though, the dotted line is...
Is this like a plastic surgery joke that no one's going to get and everyone's going to be like, they're crass? Or just, okay.
No, I mean, if they're looking at the picture, they'll understand.
Right.
If they're not, they're just going to have to go with it.
Gotcha.
So basically, it shows that there is an incision that goes completely all the way around the lower part of your torso. So,
and it dips down near the pubic area and then goes back up to your hip. And then when it goes around on your back and your butt, it follows that gluteal fold or the top of your butt, how it kind of curves around and goes into your sacrum area. There was a guy actually, and the reason why it's really interesting actually the history of the surgery, this guy, Ted Lockwood, he's from Kansas City. You've heard me talk about that guy.
Yeah, we've talked about him before.
Yeah, he was amazing. He was just like truly transformative plastic surgeon. And he was in Kansas City. I mean, we're in Denver, so I don't want to throw Kansas City under the bus, but big name plastic surgeons usually aren't in a place like Kansas City, right? They're in New York or LA or San Francisco, just like, they go to the bigger metropolitan areas. This guy was super into anatomy and actually deduced that there's this superficial fascial system in your soft tissue that has connective tissue in it, and you can use that to your advantage when you do these surgeries. And he's the one that came up with a lot of the techniques of the modern day body lift. Do you know when he published his paper? 1999.
Oh.
Okay.
Right.
And so, and then they started checking in 2000. There was only 200 of those cases. So back then, which was like right when I was getting into plastic surgery, or at least into surgical training, you would never see these cases, and they would stay 3 nights in the hospital. Those techniques got perfected. Unfortunately, R.I.P. Ted Lockwood passed away, but his acumen and intelligence lives on in this surgery.
Yeah.
So, by the way, plastic surgery, I know I'm getting off on a tangent here, is based on history. And Amy and I always joke around with the instruments we use in the operating room. They all have names of surgeons, right? So we're working on getting our instruments so we can have.
I think we decided that maybe we have to just name a suture technique after you.
Gotcha.
Yeah, we've had this conversation.
Can Nils have a little shout out?
I don't know. What's he gonna create?
All right. So who's a candidate?
So we've kind of touched on it a little bit. Most candidates for this procedure have lost a significant amount of weight. Now, whether that is through weight loss surgery or on your own, there are rare cases where a patient has never been overweight, but just has really loose skin integrity. We have a patient like that now who we actually ended up doing a thigh lift on. Would she be a candidate for a body lift? Absolutely. Has she ever been overweight a day in her life? No. She just has loose skin.
Body lifts are difficult to heal from, but there are people that have not had massive weight loss that are excellent candidates for a body lift.
Yeah.
And, it's always comes down, when you're deciding if you're a candidate or not, it comes down to that really decision-making process. Are you willing to take a long recovery to improve a lot of these issues? And are you willing to have a circumferential scar around your waist?
Yeah. Are you healthy enough for that kind of surgery?
And are you healthy enough to go through it? And most people are, but some people are not. If you're a smoker, you have diabetes, you have medical problems, you're not going to be a candidate for this procedure. And if you find someone who's willing to do it on you, don't do it. It's at least a 4-week recovery, and it's pretty intensive.
Yeah, and men and women. This is not a gender-specific surgery. In fact, I'd say there are as many men as women. Women tend to carry more weight in their lower body, but men tend to, especially after weight loss, have more of that kind of pannus that goes all the way around. They kind of have more fat in their back, whereas women tend to carry it a lot of times in their legs. So men are absolutely a candidate for this procedure too.
Right.
So this is a great slide. If you're looking, it kind of shows where the incision goes, but then it also has some color-coded areas, which is why I chose this. So basically in the red is areas where the skin is potentially being removed. The purple are areas that are going to see the most improvement. So red is going to see a ton of improvement because that skin is completely gone. The purple is going to see a lot of improvement, and then the green is going to see a very mild improvement.
Right.
What is significant about this is when you do a circumferential body lift, you do improve the contour of the thigh, and it's in a way that only a body lift can do.
Right. And in this picture, you can see on our YouTube channel, it goes down into the groin area. So they're also including a thigh lift on this. So the cool thing about these circumferential body lifts is you can design it into a thigh lift too.
They made it like a medial thigh lift.
Right.
Yeah. And this one shows more accurately how you do these incisions, kind of dipping down toward the gluteal fold versus that other one that kind of showed it pointing up.
Not nitpicking, but I would go a little bit lower on the butt. Yeah,
go lower.
I wouldn't go that high.
Yep.
But you can see the areas that a body lift really makes a big difference is that saddlebag area and the buttocks too.
Yeah.
Imagine, this is a throwback. Imagine the things, the holsters for cowboys. They used to wear
gunslingers.
Yeah, that's where you get the most lift is where the gun sits, which is right on your side, which is that saddlebag area and going into the butt.
And this really is the only way to lift the butt.
Right.
It really is, to actually physically lift it.
So historically, it's changed now with Brazilian butt lifts or BBLs or whatever. Historically, this was what we did, but now a lot of times what people will do is do fat transfer to the butt. But unfortunately, if you had massive weight loss or if you just have genetics where you have really loose skin, there's no amount of fill in your butt that you could do to fill out that loose area. So then you would end up with a larger butt that still has loose skin. It would be kind of the worst case scenario.
Right. And you'd have to have enough fat to transfer there, which
right.
Again, if you've already had weight loss surgery, you've lost the weight, you're at your maintainable weight, you probably don't have the amount of fat left to transfer the volume that you need to fill out the skin that's loose.
Right.
If that makes sense. So, and this can be done, you can do just the back part of this surgery as well. If someone's already had a tummy tuck, you can come back and just do this butt lift portion of
which
it.
We've
just
done
the back.
Multiple times.
Yeah.
The patient, and sometimes what we'll do, FYI, for people listening, considering this, if you really don't want to get into a full body lift or circumferential body lift, you can do the front first and the back later. People do it all the time.
Yeah, if you have limited downtime, if you can only do 2 weeks.
Or limited funds.
Yep.
Because FYI, this is usually not covered by insurance, even though people think it's going to be. And they don't, these are very expensive surgeries when you have to include the hospital stay or et cetera, all the stuff that goes along with it, OR fees, anesthesia fees. splitting it up is a financially responsible way to do it too.
Yeah. This slide just shows, again, kind of the areas in green are the areas that are most affected, by this procedure.
And if you're looking on the YouTube channel, I'm sorry, it's just a visual thing. There's really no good way to explain this without looking at slides. This one also includes what we would call a belt lipectomy. So it takes around the front all the way around. So it does a tummy tuck combined with the body lift.
Yeah, which is, I'd say, most common. And something that we've touched on a lot, but we've mentioned a few times that there is an extended recovery with this procedure. So there are definitely some unique post-op considerations when you're having a surgery of this intensity, let's say, that do go beyond. And we've done this with thigh lift, where we had kind of what I call like special considerations post-operatively. And this is another surgery that kind of gets some of those because, it is a longer recovery. So you can expect to spend at least 1 to 2 nights in the hospital. Depending on how you're doing, you'll have surgical drains.
Yeah, I can't imagine a scenario where you wouldn't at least spend a night in a surgical facility.
Yeah. Again, if someone's going to do this without it, don't do that.
In most cases, even with 2 surgeons working, you're getting into 5 to 6 to 7 hours of surgery. Maybe you could get to 4.5 if everything is just focused in and you have 2 board-certified plastic surgeons doing this together. But, most likely 5, 6, 7 hours of surgery. You get that long of surgery, that big of a surgery, then you want to basically monitor the patient afterwards to make sure they don't have bleeding, to administer medications that would help with blood clotting after surgery, which is a big risk with this type of surgery, and to make sure that the patient's stable otherwise. So I think at least a night under observation is absolutely necessary. If you're considering the surgery and you found the perfect surgeon, I'm sure you did, and they do it in some surgical facility, at least they should have overnight monitoring with a nurse. That would be good. Preferably, maybe they would do it at a hospital that has an ICU setting and things like that. But at the very least, I think you should be monitored at least for the first night. Now, a lot of people get confused. They'll say, "Oh, I'm getting a body lift," and they'll do one part of it, and then they go home. They say, "Oh, my surgeon's so amazing. They do a body lift." Well, you didn't really do a full body lift. You didn't do a circumferential body lift. You did the back part, or you did a little bit on the thighs, which is totally fine. And in that situation, you could probably go home.
Yeah. Surgical drains, we talked about this a lot on our episode about abdominoplasty. They are a necessary evil. You will have surgical drains in place. I would say plan on them for 2 weeks, 1 to 2 weeks, probably at least 3, I would say, 2 in the front, 1 in the back. And they're annoying and you can't shower while they're in place. So those are things to keep in mind. That's a lot of what, kind of becomes your more social downtime. You don't really feel like going places with drains. So you can, but it's,
What is that in your pocket?
Right. Like it's a good way to get good parking spots. Yeah. Wave a drain at somebody, they'll get right out of your way.
Oh yeah, just if your drain's usually full of like blood tinged fluid, you put that in someone's face, they're gonna run away from you.
Yeah, they'll move. So expect that. One of the things I think is more important with this surgery maybe than any other surgery we do is having a good support system, because you will need a lot of help and a lot of like really intense help for the first at least 5 days. Things like even getting up and down off the toilet, absolutely getting dressed. Every time you get up, you won't be able to drive for several weeks until you can sit comfortably in the seat. So there, more than any other surgery, you really need to make sure that you have a strong support system.
So let's talk quickly why it's hard to move around.
Well, when you have an incision that goes all the way around the lower part of your torso, and it's been pulled tight.
And it's pulled very tight, right? Because the idea is to lift, and to lift things in the human body and the soft tissue, you have to pull pretty hard.
And you're pulling up and down. So you're pulling tissue up, you're also pulling tissue down. Like
every movement is going to be affected. And then a lot of people don't just do the circumferential body lift, they go and do the thigh lift too. And that gets near your perineum and your labia or your scrotum. And it can be really difficult. Every movement can affect it, which is why, and I'm sure we'll talk about complications, but which is one of the bigger complications is dehiscence, which is where your wound, your incision site splits open from the tension. And that's usually related to movement. Yeah, sudden movements, and it's hard because women usually sit down to go to the bathroom. Yeah. Men have to sometimes. And, that sitting part is putting stress on everything that was surgically operated on besides the front.
Little things like getting in and out of the car. That's been something that we've had patients who, that's when they do it. They forget, they try to get out of the car by themselves. They don't wait for their partner to come around and help them.
Yeah.
I'm
feeling good.
Yeah.
Rip.
I'm fine. Yeah. And you've ripped your
And
incision
then
open.
we get the phone call with tears. They're like, come on in, we'll sew it up. It's not a big deal.
Like, what have I done? So, yeah, like the support system for this surgery is going to be longer, just like this recovery is longer. So you need to make sure that whoever you have as your kind of crew really understands that you need more help than you will express that you need.
Yeah.
Like they do kind of need to be like all over you, making sure you don't hurt yourself.
You definitely need a team.
Yeah. Or just one really awesome person, but
Yeah.
you're
on my team.
I would be on your team, and
You're my
I'll
one
get
team.
out of the car.
I hire you for my body
Yeah.
lift, that's for sure.
I got you. Yeah.
Okay, that's good.
And then also the length of time you'll probably need off work. And this is, unless you work from home and can do things, in a semi-reclined position for several weeks, you probably are going to need at least 2 to 3 weeks off of work.
Right.
Maybe even a month.
After the surgery, I'm going to sneak ahead here.
Oh.
Okay.
We
So
don't
after
have
this, that's okay. After the surgery, talking about complications, the complication rate with a body lift is higher than any other surgery we do. If a plastic surgeon you see tells you that's not true, you can just give me a call, but I won't talk to you. You can talk to Amy. We'll send you all the articles in the journals that are peer reviewed that shows you that a body lift has the highest amount of complications, not just from the malabsorptive issues we talked about, because it's, a 5, 6, 7, 8 hour surgery that puts a lot of tension on the soft tissue around your torso, and every movement puts tension on the surgery site.
It's almost impossible not to have, rubbing and, pressure. I mean, you have to, like I said, semi-recline, but you have to sit and lay down at some points in time. So you're putting pressure constantly on one part of that incision, which,
Right.
There are a lot of inherent issues with having an incision of that length.
So what happens when you do a surgery that every movement can affect the surgery? What do, Amy? You don't move. And then what happens when you don't move?
You get blood clots.
You get blood clots. And what happens when you get blood clots?
You go back to the hospital.
Right. And then you can have something called
a very bad day.
like a pulmonary embolus.
Yes.
And so then what we usually do is use low molecular weight heparin or something to thin your blood a little bit. That has complications with it too, or can have a risk with it too, excuse me. And then also you have a huge raw area, right? A huge area that you operated on. Those areas can get hematomas, and like right after surgery, which is a blood pooling, or afterwards. For sure, in almost all cases, you're probably going to get a little bit of a seroma. There's only so much of that inflammatory fluid that the drains can take out. So when we say a high complication rate, not everyone is like, oh my gosh, it's the worst thing ever.
Right, they're not bad complications.
It could be a little infection, it could be a seroma, but these things are I think you need to go into the surgery expecting that you might have a couple hiccups.
Yeah, and then if you don't, that's really awesome.
Right.
And that's absolutely the way maybe going into any procedure. You have to really consider that the risks are very low, but they do exist. So being prepared for that possibility mentally is very helpful. I mean, you don't want to be thinking worst case scenario because these complications are not always serious. We might see something as a complication. You have a little area of, your scar that opens up a little bit that doesn't even need to be closed. Like it just doesn't look as good as the rest.
Right, and that's technically a complication.
Yeah.
So serious complications with these surgeries, if you go to a board certified plastic surgeon that has expertise in these surgeries, you should be fine. But that's where patient selection is really important. So you want to go to someone who's kind of critical, and if they tell you, hey, you're not ready, you need to listen to what they're saying.
Yeah. On the flip side of that, though, I mean, this, like you said at the beginning, is probably the most transformative single procedure surgery that we do.
Yep.
So the change to the buttocks, the change to the outer thighs, like nothing else we do can do that. So if those are your problem areas, like don't be freaked out that this is a terrible surgery to do. It's an awesome surgery. Just
Right. So
be ready.
the flip side, if you have saggy butt, saggy inner thighs, saggy outer thighs, saggy lower extremities, this surgery is crazy transformative.
Yeah, it really is.
Yeah.
Yep. For men and women, men
For men and women.
tend not to have as much like excess fat in their lower extremities, but again, they tend to have a lot of loose skin.
Oh yeah. Especially
So,
with weight loss.
Yeah. Fix that pancake butt.
So, what's the answer? I mean, you accept the fact that this is a little bit of a higher risk procedure, but it's not so risky that we wouldn't recommend it. But then it's so transformative. I feel like the value equation is positive for patients.
No, as long as you're prepared, you've got an excellent support system, you've got the time off, you're mentally prepared for the length of your recovery, you're going to be just fine and you're going to love it. And this scar is hidden. So the pictures that we showed earlier, like Dr. Martin said, he would put that incision lower. I mean, you could wear a bikini bottom after the surgery and have no one know you'd had this surgery. Like it is completely covered by underwear, by a swimsuit. It fades very well. It's in an area, part of the body that tends to scar well. So your scar should be thin. Like
Right.
it's a thin little line. You keep it out of the sun, it'll fade away.
I never feel like the body lift patients mind their scar because most of them have so much excess skin and soft tissue that the scar is totally worth it. Just like a breast reduction patient kind of.
Yeah, you're getting rid of a problem. You're trading skin for a scar.
Yeah.
But the scar in this case is...
That to me, from a value equation, is definitely positive.
Absolutely. Yeah.
I mean, what else can we say? It took us 71 episodes, but I mean,
We got here.
We got here.
We started from the bottom. Now we hear it.
Okay.
So thank you everyone so much for listening. We really do appreciate it. And if you have a question or you think there's a great topic that we could cover, please let us know. We love hearing your comments. Ratings and reviews really do help us out. You can find us anywhere you listen to podcasts. I personally listen on Podcast Republica.
I listen on iTunes.
Yeah, we're also on YouTube at Jason Martin MD and on
Actually,
Instagram.
by the way, I want to that's not true. I watch the YouTube and then I'll listen on iTunes also.
Well, I listen on iTunes and Podcast Republica, and I watch the YouTube videos.
Crazy.
Because I'm just that much of a fan. So we really do appreciate it, and be sure to check us out on...
And if we've missed a cosmetic procedure, which I don't think we have, I think this is it.
Well, the ones that are mainstream.
So write into us. Tell us there's a surgery out there that we haven't talked about.
All right. Thanks, everyone.
Thank you.